Good morning, good afternoon, good evening. Again, depending on where you are in the world. Welcome to episode number 48. We are getting closer to the proverbial half century uh, of the Unboxing AI webinar series. Uh, every Thursday, 11 a.m. Eastern, you will have to bear with my face with one of our friends, collaborators, partners. Today, absolutely honored to have Alan Hundley from Riverain. We've recently signed a partnership with Riverain. Very, very excited about it. Of course, we'll talk a lot more about that. And for those of you who don't know what this is, well, like I said, every Thursday, 11 a.m. Eastern Time, um, CARPL brings on one of their friends, partners, collaborators to unbox this world of AI. Right, AI has long been considered a black box, and we try to shed some light on that black box and talk about some of the challenges, the future, the present, the past, and what have you. And if you don't know what CARPL is, now you will. We are an enterprise imaging AI platform helping you navigate the relatively complex ecosystem of AI applications out there, bringing AI into your clinical workflows through a single user interface, single data channel, and single procurement channel. Allowing you to build, test, deploy, monitor all sorts of AI. And shameless self promotion aside, let's get to Alan. Alan, thank you so much for doing this today. Absolutely.
Absolutely. Thank you for having me. I appreciate it.
So, as is customary in these things, I'm going to start off by introducing you. So, Alan is essentially our lifeblood at Riverain, but yeah, he's the global director for channel partnerships. Brings more than 10 years of experience in marketing, selling, launching innovative vendor-neutral radiology products. So, prior to Riverain, Alan was at Philips and In Vivo. Very very famous company. I'm sure most of us would have heard of. And then about I think 2.5 3 years ago, joined Riverain, um, taking the plunge from a large established company to a small established company, if I may say so. So Alan, why that switch?
Well, first and foremost, I think it was the solution, which we'll jump into today in AI, right? I was seeing the growth of AI. I was seeing AI being asked for. The market was getting very busy in terms of the ask around AI. And I saw the opportunity, as you mentioned, product launches, right? That was something I was a part of a lot at Philips, and I'm very passionate about that. So when I saw the opportunity of Riverain to come into a space specifically in lung cancer screening that was growing rapidly, not only in the US, but around the world and globally, and I saw the software and the solution and the opportunity I had to impact workflow for radiologists, but also patient outcomes, and be able to help grow that from the ground up, and be able to be proud of that. Something I was very excited to do, and I'm really glad I did it.
Is
Coming
it is
from a
it
larger,
then
more
is it then
established
safe to say,
company.
Alan, that because obviously from an impact perspective, there is no question, right? Philips would have like
Yeah.
million times more impact or 1,000 times more impact than anything we're doing at least today. So, but is it then about like feeling or driving the impact, if I may, like what's
Yeah,
the goal there?
absolutely. There were many solutions at Philips that I worked with and in Vivo, and again, an established organization, great market share, of course. But there were certain things that I asked from physicians over the years, um, that I felt would be so important to workflow and outcomes. And when I had the opportunity to speak with Riverain, and I saw what they were doing, immediately I thought back to the conversations I had had with so many stakeholders and physicians and individuals in pulmonology and the downstream programs and departments, as well as what they need, what they want, and what would help them do their job more effectively and more confidently. And when Riverain explained what they were doing and what they were able to bring to market, I jumped at that opportunity, thinking back to all those conversations I had with clinicians on what would impact them the most, the why, right? Why are we doing this? And I saw that with Riverain, and I think as you've seen over the last 3 4 years, we've grown rapidly as an organization and company, and I think that it's because of that we're able to touch lives and impact workflow.
No, we'll certainly come to as we discussed what you guys have done differently. Also, to everybody listening in, as many of you may know, we do prioritize your questions over our own deliberations, discussions, quantifications, what have you. So please feel free to shoot. There is one question. Let's see what that is. Perfect timing. Um, so this is from Himanshu. Himanshu has recently joined CARPL as head of products. He says, I came across the news about significant year-on-year growth in channel partner activity. Very pertinent
Yeah.
question of 240%. What
Yes.
strategies have been most effective in building and expanding these partnerships? Interesting. Nice.
Um, I, this is going to sound kind of cliche, but trust and communication. I,
Hmm.
I think I think it's so important. I think the when you look at partnerships and fostering partnership, it has to be that, right? It can't be competition. It can't be just placing an algorithm into a large marketplace or catalog and hoping it sells. Every product is different. In particular, Riverain is very different from the other lung solutions on the market, right? It's our job and my job to communicate that to all partners, to foster those relationships, partnerships, grow trust that your team at CARPL or the partners we work with are confident to call us and bring us into a boardroom and be the experts in lung while they're the experts in the platform that they are selling and the partnership with that facility. And so when you can collaborate like that and be consultative and go into these offices and accounts shoulder to shoulder, the trust you can build with customers, the how quickly you can do that is tenfold rather than just placing an algorithm into a marketplace or a catalog, right? And over the last year and a half in this role, I think that has what's led us to be so successful and see this growth is communication and trust, and education is very important, right? Multiple platforms have numerous solutions in different subspecialties, whether it's lung or neuro, right? And not every lung nodule solution is the same. So I pride myself on ensuring that all of our partners and their sales teams understand the elevator pitch and the 30,000-foot view of why are we different? How do we differentiate from the other solutions? And then you can push cost to the side, and it's about patient outcomes and workflow and when you can build that trust, it's very hard for the customer not to implement.
No, I think that's very, very well said, Alan. Trust and communication. We should probably, put that on a wall, although we shouldn't need to, but so no, so thanks so much for that question. Uh you know, no discussion about lung cancer screening today can be had without the mention of Australia.
Yep.
Right, the entire country is gearing up for starting what is probably going to be a very, very massive lung cancer screening program.
Yeah.
Um, and AI obviously is going to play a very vital role there. Can you share a little bit about like Riverain's experience globally
Mhm.
of doing lung cancers, of running lung cancer screening programs, or of being used in lung cancer screening programs, and how you navigate the differences that each geography presents, right? Because uh, every place has their own opinion on what kind of reporting structures and standardizations and
Yeah.
how many nodules, how big a nodule, etc. So how do you navigate that, and do you have any concrete plans for Australia?
Yeah, I've been working with many accounts in Australia in terms of educating on them on what we do, and not only Australia, just briefly to note, I mean, there's synergy across the world, right? When you look at programs being launched in Germany and all across EMEA, UK, Norway, I anticipate it's going to be launching something formally. But in Australia specifically, you know that many of these programs come with the strict requirements, right? So you have to be nimble, you have to be flexible in terms of reporting and scalable. I think scalable and interoperable are probably the two key words here,
Mhm.
Vidur, that
I like
if
it.
you're not able to,
You're able to come up with like keywords very well, Alan.
yeah,
Thanks for
and
that.
that's on the fly too, I promise. It's not scripted. Um, But if you can't allow a customer to customize and you as a company cannot tailor to a specific need or a specific goal of a customer or even a country in this space and their requirements, I think you're going to have an uphill battle. There's going to be a lot of headwinds. For example, in Australia, I think volume is going to be very important in terms of noting that on a report. Just an example of a volumetric. Well, in the US, we use diameter,
Yeah.
right? So we need to be able to provide everything, and we do. We need to be able to not only export into a RAD report, but we need to be able to generate structured reports. Can we export via HL7 into third-party information systems? Can we configure the number of nodules, the size of nodules? That is going to differ in every program across the world in terms of what they want on a report and the output. And Riverain, I feel, and our solution has done a great job of focusing on the customer and the patient ultimately on you tell us what you need
Yeah.
and we'll work with you to tailor that. And if you're not configurable and you can't customize and you're not going to be vendor neutral in terms of pack systems or, the partnership that we have with CARPL, if you're not able to be vendor neutral and work with many partners and platforms and packs companies, it's going to be a struggle.
Yeah, it's so, again, it's one of those very obvious things, right? That
Yeah.
you should not have to, at least, and in our world of AI where things are like, still playing out, like you can't really go to a customer and say, this is it, right? Figure it all
Nope.
out. And I think that is that's something we're very excited about partnering with you guys about for Australia. So yeah.
You bring up a great point. You can't say that's it, right? And I think every great consultative sales conversation, I don't even think of them as sales conversations when you're having a great interaction with a customer. It's understanding their goals and their needs. And that you have to be able to tailor if you want to understand their goals and their needs, you're going to need to be able to tailor to those goals and needs. You can't be a black box or just a box, right? You can't be transactional. Um, the days of just selling a capital piece of software and equipment are gone. You need to be able to sell a program, right? How are we going to impact screening? But now we can get the information into a patient management solution because of our export capabilities. So your pulmonologists and nurse navigators can manage those patients through the rest of their journey after they leave radiology. We're
Yeah.
not just touching radiology. And if you are only touching one phase of that patient journey, you're going to be in
So
trouble. And
can
I
you
think
can you
those are the
talk
most
more to that,
successful.
Alan? The impact that Riverain solutions have on some of these downstream players, right? Whether
Yeah.
it's the nurse navigator or the pulmonologist, or I don't know, even the thoracic surgeon.
Yeah.
Like, uh, do you have like an example that you can explain? Because that's very, very interesting.
Yeah, I think if we align with the screening conversation, I think the first thing there is going to be able to get the impact you have on nurse navigation and the patient journey, first and foremost. A nurse navigator, if they are doing things manually and having to pull things manually, track things on a spreadsheet, they don't have a patient management solution, he or she, it is a lot of work. It's tedious,
Yeah.
right? And you also need to remove inter-reader variability in radiology to help them. If a nurse navigator is empowered knowing that no matter the patient that walks through the door, they're always going to have the lung rad score, they're always going to have the volume, the diameter, because one radiologist prior to the software may not have included it, and they have to pick up the phone and call, they have to email. We're able to get those results into those other departments to help them be able to get that patient back in the door more quickly for that next step, whether that's a biopsy, whether that's a navigational bronchoscopy, right? We have robot companies that come to us all the time to go shoulder to shoulder to discuss what we do in detection, because that's going to impact the volume and the amount of navigational bronchoscopies, especially in lung cancer. You get past stage 1 and 2, and it can be too late. So we have to find these sooner, and we have to be able to get them to treatment sooner.
Is
And if
there
we can
is there
get
also
everybody
a
what they
pharma?
need,
Is there also a pharma angle, Alan? Like, we've seen the likes of AstraZeneca, Novartis, etc., sponsor, like,
yeah.
X-ray AI solutions and all that. Like, does that play out with lung, like CT as well?
I think it can in terms of cost of treatment, right? I mean, if we can find nodules and our sensitivity and specificity is great, which it is, and we're accurate in terms of detection, that can go to biopsy, that can be tested or go to pathology more quickly, and you're going to be able to send that there more confidently because you're confident in the solution that detected it. And
Yeah.
if that's the case, you're opening up the door for more accurate or precision medicine is probably the word to use there, where you're going to be able to tailor that treatment to the patient more appropriately, because you caught it sooner, because you had software in place on the front end. So I don't work directly with pharma, Vidur, but I do absolutely think that when you find things sooner, and you find them
That's
in a more
everyone.
accurate manner, it impacts cost of treatment,
Yeah,
right?
yeah, yeah, yeah. Correct. Nice. No, there's a few questions that have come in, Alan. Let's just run through them one by one. The first is a very good question from somebody who doesn't want to be named. Does Riverain support photon counting CT?
Yes.
Oh, fantastic! I love binary answers. Uh,
So one of the things we do
is there like a
is image.
separate approval or something needed for it, or is it just the
No,
default
no.
product?
So what we're able to do, we use image normalization. So we actually remove all the OEM information from an image when we process. So we normalize kernel type, enhance sharpness, resolution, all these things that occur and can impact an image at a machine level. We remove that and do the normalization. So Riverain actually sees every image we process, it sees it as coming from one CT machine, which is great because we are ultimately future proof, is what we like to
Yeah.
say, because scanners and photon counting scanners and OEMs are going to continue rolling out more advanced solutions in terms of CT machines and modalities with software and protocol, where we need to be confident that's not going to impact these algorithms, right? If they are trained on that information from older machines, is it going to impact them in the future when new machines are come out? And so by being able to normalize images and use synthetic data and simulation, when these new machines come out, we can get images, plug them into our engine,
Yeah.
train it immediately, and eliminate all bias too, because it's not using patient information, which is great. So we're very nimble and flexible, like we talked about at the beginning.
Got it. But the single answer is yes, which is pretty
Yep,
good. The next is from Sarang. Sarang is the medical director at CARPL. He asks, whether Riverain's platform currently supports LungRADS 2022 and the PanCan risk model for lung nodule assessment. If not, are there plans to incorporate?
absolutely. So today we support LungRad's 1.1. I believe most solutions on the market today are a modified version of 1.1. We'll provide a recommendation using LungRad's 1.1 with the disclaimer. And then, of course, if an endobronchial or cystic lesion is seen, then the radiologist would need to make that change in the report based on LungRad's 2022. But
Mhm.
we are in the testing phase and submission phase today for endobronchial and cystic lesions, not one or the other. And our aim is to be the first fully automated LungRads 2022, not semi-automated, but fully automated LungRads 2022 solution by the end of Q3 or Q4 this year. But we can absolutely provide the recommendation today using 1.1.
Fantastic. Next is from Ashutosh. Ashutosh asks, to improve the customer's confidence in Riverain's differentiated lung solution, do you offer a validation or testing of Riverain performance on customer data sets prior to a deployment? Or do customers mainly rely on your testimonials or research studies?
Yeah. I think both. We absolutely will accept anonymized data studies, and we will run it out. We will run the report using vessel suppression detection and prior nodule comparison, and we'll send those results back to a site or a partner so they can be integrated into packs, so they can actually see that in their workflow using that concurrent reading capability, or inject them as a series and data set, because we are unique where there is no launch of a
Yeah.
viewer. There is no secondary solution. We're approved to be the primary data set. And I think we're the only solution still today where vessel suppression can be read first before
Yeah.
the original study. That's a very important approval. So we will accept anonymized data, but we also will include pilots in our subscriptions. So we will add an additional 30 days on the front of a subscription prior to invoicing for them to be able to use the solution in their environment and on their patient type, be confident. And that's the confidence we have in the product. We want
Yeah.
sites to be confident in it.
No, I think, and that's perfectly aligned with the philosophy we have at Koppel as well, right? That uh, try before you buy, so that you know what to expect, as opposed to
Yeah,
and if you're confident on your product, like nobody should have, like in 5 years
yeah.
1 month means nothing, right? So that's very, very nice to know. The next is, how do you evaluate ROI for your customers? Is it more about diagnostic accuracy, time saved, or cost efficiency?
So both, you again, Riverain's unique that we offer a data set called vessel suppression, which removes all the visual obstructions from an image. So radiologists can look at the image more efficiently and really have that needle in a hay. Ultimately, you're looking for a needle in a haystack when you're seeing all the vessels there, and we remove all the hay, so you only see the needle, right? And when we can do that, there's an efficiency gain. And our data showed 26% reduction in nodule search time just using vessel suppression. Up to 35% recently at the University of Washington with residents. So when you look at the academic side, that's important because they're training, and that time savings can be even greater. So there's two things we do on ROI. We have a calculator that ultimately looks at our data that showed 30% reduction in missed nodules. And then we look at the 26% time savings. And we have a calculator built on source data. So chest publications, American Cancer Society, our reader study, everything is sourced where we can plug in the volume of chest CTs at a site. And we know and have percentages of where these patients go after an incidental is identified. And we plug that into a calculator based on reimbursement. It's editable too by region. So if you want to edit that, so we'll show ROI over 5 years and then also time savings. And when you look at that 26% reduction and a site's doing 50,000 to 100,000 CTs a year, you can walk in and say, you're going to save the radiology department 18 days, 19 days, 10 days, right? And that's impactful. And we have that data and we can share that with partners as well.
That's fantastic. No, that I think that's a beautiful thing to be able to do. Wow, questions are just pouring in. Uh,
I
Next is,
hope that's a good thing.
oh yeah, yeah. I think this is the most we've had recently. So from Riverain's perspective, what are some of the key barriers to entry, or barriers to scale for lung cancer screening programs, like in Australia? Are they regulatory, infrastructure, clinical? So, what is like a barrier to the adoption of AI for lung cancer screening?
um, I think if you're looking at the detection tools, I think you're going to have a lot of sites because reimbursement can be limited, especially when it's rolled out by at a national level. Many sites may say they want to try and handle it manually until they have a better understanding of volume, right? So we may have to wait a little bit to get an understanding of what volume truly is. We
Yeah,
have projections, um, but I would say that, and then with limited reimbursement costs, I hate to bring up costs, but it's important, right? It is a business as well. They have to account for the cost on an annual basis. And so I think the biggest barrier in those markets is one, I think you got to know what the formalization looks like. And I think some of these programs may change and be fluid in terms of the requirements once they launch. So some sites may step back and say, hey, I don't want to take the plunge just yet into a software or platform until I truly know what volume is going to be and what the requirements shake out to be. But other than that, an area like Australia, I think burnout is at an all-time high in radiology. And with that, you can't have a screening program without a CT, which means there's going to be volume that comes into those facilities that was not there last year.
yeah,
And how are radiologists going to deal with that? And so the most valuable part of our messaging in this space and the most value that physicians are seeing in terms of the feedback I hear is it's not about the detection. It's about how can you help me save time, right?
yeah,
Because I have to be able to get that time back somehow. I'm already bogged down 8 to 5. And so it's done a shift over the last 2 years. But 2 years ago, I would have told you we're getting calls because of detection.
yeah,
Now we're getting calls because you got to come help me be more efficient.
yeah,
And
yeah,
so it's weird. It's been cool to see that shift.
yeah. No, that I think the burnout is real, and you're kind of not dumping, that's a negative word, but adding,
Yeah,
I don't know, 500,000 scans to be reported by someone, and very high
yeah,
implication scans, both from a clinical and a medical legal perspective.
yeah.
That stresses
And
people.
think about the third party radiology groups in Australia, right? There's a few groups that manage a lot of the country, and these radiologists, many of them, one, they're not thoracic specialists. We're seeing a decrease in thoracic specialists in
Yeah.
radiology. They're
Oh, and
reading
they're all
body,
doing
right?
cardiology then, if they are. So nobody's
Yeah,
blaming
yeah.
them.
They're reading everything. They're going from MR to CT to X-ray. I mean, and they're reading for 3 or 4 hospitals.
Yeah.
So now you're going to add 3 or 4. They're already reading on the weekends and at night, right? So if you're adding 3 to 4 hospitals of lung cancer screening volume to a radiologist's workflow, if you can't save them time, I don't think you have a chance.
Yeah. No, that's very well said. Uh, what's in Riverain's roadmap for Q3, Q4 this year? Uh,
Yeah, so today we offer lung nodule solutions in X-ray and CT. And on X-ray, we offer bone suppression and image enhancement too. It's not just about the nodule. We actually do image enhancement to remove the need to manually um, enhance the image, the window level per se. We just launched our coronary artery calcification
yeah, I
module.
saw
We
that.
just received
Yes.
approval globally within the last month or so. So very excited about that on all non-gated, non-contrast chest CTs. That was a strategic decision on our team's part to align with the study types our CT nodule solution is typically working on, which screening with the growth of screening, we think that reporting CAC with those screening studies is going to be so important. But again, you need to be able to automate that. And so we're going to be able to do that, get it into the report. The next product we launch will be lung tissue analysis or emphysema. We'll
Oh,
do
nice.
a lobe by lobe quantification and provide an emphysematic index. Beyond that, we are also going to be launching a solution for rib fracture within chest CT. And I think the most valuable feedback we've received on that is, and the excitement around it is, we're going to be able to not only label the rib, but also give you the rib number. So doctors are not going to have to go in and
Um,
count the ribs in the CT so from a time savings perspective, everything we do is twofold. We want to improve efficiency and workflow, but simultaneously enhance confidence things aren't going overlooked,
yeah.
which is a tough relationship to have because a lot of times you don't get faster and better, right? And so
Yeah.
that's what we're trying to do.
No, awesome. I have a couple of more questions. We'll go through
Yep.
really fast. How does Riverain test for bias and fairness for their clear read solutions? What are
So we don't use any demographic or patient information. We have no demographic data, no race, gender, ethnicity. We use pure synthetic data. So we generate all of our study types and studies synthetically and then simulate using that. So we eliminate all bias.
fantastic? And are there any exclusion criteria you specify for your algorithms when running on live?
So great question. There's a lot of solutions, for example, that don't work on contrast studies. Our CT nodule works on contrast and non-contrast.
Wow.
We also work on any chest CT with 80 millimeters of lung. So even some abdomen pelvises, some limited field of view studies. The only thing that's required is we do require thin slice data. So it does need to be 3 millimeters or less for processing. So that would be the other one. So that would be the only
Nice.
exclusion.
And last question, or maybe I'll ask my last question. We can answer
Okay.
our lives. Apologies to the two anonymous attendees whose questions we'll answer later online. Alan, Riverain, there's a lot of companies that are building, have built,
Excuse me.
solutions for lung nodule detection, etc. Uh, Riverain stands out as possibly, uh, one of the most successful, right?
Yeah.
Why? Like,
Um,
what can I? So I'll rephrase. If I'm starting an AI
yeah.
startup today in healthcare, maybe radiology, maybe something else, whatever. Uh, what can I learn from your journey that can increase the
Yeah.
chances of me succeeding?
So at a high level, I think any algorithm that's launched today, if you're going to be developing an algorithm, it needs to be vendor neutral. It needs to touch multiple specialties or disease states. Sites want to reduce the number of vendors they work with, not increase them. I think you need to have plans to be able to deploy in the cloud if you're not already are today and on-prem. You need options and flexibility for IT too. They're just as important. They sign off on a lot of this, right? Scalability, but it needs, and you need to be able to touch multiple facets of a workflow, not like for us, not just detection. We're also touching efficiency. You can't just have one focus. You need, again, to be able to tailor to a customer their needs and what's most important to them. I think what also helped Riverain be successful in terms of a startup was we focused heavily on academic institutions at the start and at the launch of the product, which helped us generate a lot of data, a lot of information. We are the most peer-reviewed solution and have the most publications or academic papers in the world when it comes to lung nodules. And one of those is because of the relationships and the opportunities we had at some of these large academic sites, like the Dukes, the University of Michigan's here in the States. We work with MD Anderson. I think that's very, very important. You need to have the data and you need to be able to prove it. And so data, and then I think interoperability and vendor neutrality.
So
That's key.
I think neutrality, flexibility, and academic creds, right?
Yeah.
And I guess also persistence, right? Like you are also one of the oldest companies out there, like in our new
Yeah.
world. But yeah,
Yeah.
thank
And
you,
you need to
Alan.
understand the market and the
Yeah,
problem at hand, right? You need to
exactly.
solve a pain point that is real and at that moment in time. And when we launched, screening programs were starting to be formalized in the US and volumes were rising.
Yeah.
And so we tackled that pain point. And now we're doing it globally.
Awesome. Solve someone's pain.
Yeah. You got to
No,
have a why, right?
thank you,
Got to
Alan.
have a why. Yeah, of
Thank you so much. This was amazing.
course.
And thank you to everybody who joined. And we will see you next week, same time.
All right.
Awesome.
Thank you for
Thanks.
having me. Have a
Thank
great day,
you.
everybody. Bye bye.